Hello, everyone. Greetings from our side. So, we will be, presenting with you a very latest reporting tool that we've created for like dental practice in the US. I'm just going to, walk you through some of the features, going through the dashboard, and also, covering the other features that we have. Once we go to the homepage, we can see like different dashboards that we've created for this particular reporting feature. Then we also like this is a complete portal that has like different kinds of data for like this particular practice. We can sync in the organization from here. Then we can also select which location are we looking in the data for, right? So basically it's all is possible once like an ETL pipeline is collected on a digitalized business like a dental practice in the US. So basically all their data that's coming in, let's suppose like their patient management, their appointments, their collections, their payment management system, everything is digitalized. So all this data is actually going somewhere. What we've done is that we've aggregated all this data and we placed it into one place, and that's called our data warehouse. And this is the place that we can see our data in, and it's just like a normal dental practices data. As we can see, this is for like a mart dental practice. This we can see like different rows for different patients. We can see appointment numbers. We can see like different kinds of like patients who have been incorporated, and this is all the kind of data that has been collected for like this particular practice. So these you can see like there are so many different dimensions to it. So like this is just like a very regular patient collection data from like a dental practice. So if you can go back into the platform, and we can see like this platform is actually pointing to a certain location, then we have this organization that I'm in. We can effectively we have different dashboards that are effective and useful for the business owner to understand what's happening in the business. The main problem that we had the main problem that every dental practice has is that they don't understand like their data, and like they don't have that kind of data visibility until their monthly end of the month report comes in, and then they understand like if their dental practice is in profit, or like if they're lacking in certain areas, what are those areas. Because it's like a physical business, it's very hard to keep track of. And also like the professionals or like the business owners, they are actually working in their business as well effectively, so they don't have like the time to actually look at these reports every day, because it's just like a physical business. The nature of business is different. So there are different dashboards in that we've created for like this particular portal. I'm just going to walk you through some of them, and let's see like the daily dashboard. What does it do, and how does it help the business owner understanding like what's happening in their practice. So daily dashboard report is mainly something that they would be going looking at every day to understand like how they are performing in like a certain day, and what are the metrics they have to achieve to complete their month on a certain level. So you can see like the previous day's metrics over here. The appointments for the previous day were pretty good. They were at 77. Then we have like a missed appointment rate at 8 appointments per miss. So the hygiene conversion, the recare percentage, it actually means like all the patients that have been provided with recare. This means like also an excellent retention rate, because a lot of patients that have already been treated, they're coming in for recare. So conversion, this means like for the same day conversion, this means like the patients have been the cash has been collected from the patients on the same day. That's actually 13%. Then we treatment conversion would be at 39%. Then this is just like the metrics for like the previous day. Then we have like created appointments. Then we have like patient collection that's sitting at 95.5. So a good benchmark for like a particular patient collection to be is at 95%. So this is reflecting a healthy number, healthy work for like the previous day. We can also see like today's numbers. We have appointments, and we have net production for like today. Then we have like new patients coming in. Then we have different kinds of metrics that we're looking at, and we're trying to analyze like how the business is performing. So like for today, you can see already like the appointments have been low from the previous day. So, and the production that has to come in is at 24.6 k dollars. So for the next day, we can see like the appointment collections are a little bit higher, right? So net production would be also higher, maybe also coming in from the patients that are being treated today. Then we have new patients coming in, treatment opportunities, all the different metrics that are present for the next day. Then we also look at the month's numbers in this daily dashboard. So we'll be looking at like net production. We have seen like a completed net production at 175.9K, and then we have scheduled net production towards this. So this is like a lot of money that's actually coming into the business within this month. So we have to keep the pedal. keep the foot on the pedal and keep pushing through to actually achieve this number in the right amount of time. So you can also see like this collections rate. This is the collections that we are seeing. This is the amount of collections are basically the heart of the cash flow that's coming into the business. So higher collection means like we are collecting large amount of that large amount of cash from like the patients, from like the insurances and everything. And we can see other then we have like a patient collection for like this month has been pretty good over here. Then we can see like the claims numbers as well. This is all the insurance money that has to come in. And you can see like the claims are waiting in queue, and claims are actually in process. So these are all the different metrics that you would require in a daily report. Then we also, when you can see like what the executive dashboard is representing, if you can dig into this as well really quickly. So like the executive dashboard, it's like a overall health analysis of like how the business is performing, and like how to effectively increase chair time and effectively reduce missed appointments, and also money that's actually lost in like a lot of claims and other kinds of stuff that negatively impacts the dentist dental practice. Then you can see like the net production number for like this month has actually went down by 9.3%, and then we have like collections are also down. So like this is just like an executive summary for like the whole month. So it's like a combined view and like a combined analysis of like how the business is performing this month, and like what are the metrics uh, we can target to actually improve efficiency of the business, improve productions, improve number of collections from the patients. So you need to have like a very excellent cash management strategy. So like you can see over here the reasons these numbers are actually very they're dropping is because the patient ER is actually increasing. This means like a lot of money is owed by the patients. Then we also have like insurance money. This is also sitting at 58.24K. Then we have like claims follow up money that's actually sitting at 37K. Then there's like this deal section is actually showcasing the operational performance. Again, like these are numbers like about how you can increase the number of productive days. You can increase the number of productivity for the business. We can how to reduce the number of missed appointments, and how to reduce the number of appointments that were lost just because of inefficiency for a certain business. So you can see like these numbers present in the deal section here. Then we also have like a patient performance section. We have patients served. Like this is just like the performance of like how many are new patients coming in, what are the patients have already been served. So this is actually reflecting a very healthy number at 46.3%. This means like a lot of money that's been invested into the marketing campaigns for dental practice. It's effectively being utilized, and a lot of collections, a lot of new patients are coming in. And we have a recare that means 95.7% for a month. It's a very good number. It means like a lot of patients that have already been treated are also coming back. And similarly, we have like this is just like an executive summary for like the month. So a dentistry business owner can utilize this particular report to effectively see their business from a bird's eye perspective, and also understand like what are they lacking in a month, and like how to effectively plan for better efficiency within a certain month. Then you can also see like we can also go into this performance summary report, and this would be like a bird's eye view, or like maybe like a much more I think bigger view for like a bigger radar for like what are they missing at, and like how to improve their numbers, because this is a 5 year uh, 5 year comparison about like how their performance has been across like the 5 year period. So like this is the period that has been selected from 2023 to 2028. So we have a net production area that you can see over here. We have collections over here. So as you can see, like the collections are actually higher than the net production. So this actually means like your cash management strategy for like whatever you've been doing for the past 5 years has been excellent, because you can see like the collections have been more than the production, right? So we can also see insurance income that has come in. So you can see like the earn income that you need to be earning. Then we also you can see like future scheduled production, right? Then you're also seeing like a net production versus collection overview for like 2023, 2024, 2025, all the months that have already been covered. So you're seeing like in the only 2023, the collections were actually lower than the amount of production. So that means like there was some money lost in like 2023. Then this was not happening in 2024. The rental practice has bounced back well, and we're all effectively seeing positive numbers through 2024, 2025. So whatever they're doing right now, they need to be doing for 2026 as well, so to ensure like their cash management strategy is highly effective. Now we can also see a performance overview for like each particular month, and this is just like very much helpful to spot any anomalies inside of like in their data. So let me just export one. So as you can see over here, like in November, like the collections were extremely low, right, compared to everything else. Like they were at least three times lesser than like what they were. So like this might be seasonal issue. This might be an issue related to a certain marketing strategy. Maybe like there was something going wrong within November 2025. So this needs to be, this month needs to be carefully analyzed to actually prevent mishaps and like to prevent losses like this occurring in the future. So you can see like different kinds of, adjustment, production, write off. Then you have like net production again. Then we have total patient income, total earning income. So all these metrics are very much important for the dentist to actually understand like what they can do and like how they can do it to actually improve their dental practice. So I don't have lot of time, so I'm not going to go over like a lot of other dashboards that we have, but instead I'm just going to showcase some of the AI features that we do. So with the AI features, let me just like dig into. I've actually selected a different organization. I'm not able to run the AI features on like the organization that I was showing dashboards for. So I'm just going to show you from here some of the AI features that we have. We have like an AI assistant chat that allows you to effectively talk to your data in like a natural language. So in natural language, that means like in English, you can just like ask a simple question, like just ask it how much my practice performing, and it will give you the analysis. Even if you're not a business oriented person, if you're not understanding like what I need to be looking at, it's actually going to effectively tell you everything. Like it's effectively going to tell you like how to analyze your business, where to come from, where to which metrics to look at, how these numbers can be improved. It's actually very helpful in actually drilling down these metrics and numbers and helping you understand like the way that you want to looking at your business. So this is just like an AI chat feature that we have in it. So we're not going to dig in further. Just going to showcase this response profile so you can effectively analyze what you're looking at. Then instead of this, like we're also going to show you some of the podcasting features that we have. So we have like different kind of podcasts that we built in the system. This is also AI generated podcast. It's effectively a concept that maybe a dentist does not even have the time to chat with the data in natural language. So like maybe the business owner is not free enough to actually do that. So what they can do is that effectively every day they're going to their office in the morning, what they can do is that they can just like open up any of this podcast, like, right? So for Practice Pulse podcast is going to be a very good podcast for understanding the health analysis for your practice, especially for like a particular month or like a particular year. So it's going to give you it's going to give you analysis for like a larger period of time compared to the daily digest. So I'm just going to look into Practice Pulse report, and let's see like what kind of analysis it can bring us, like how this podcast can be helpful for the business. So the podcast has started to generate. I'm just going to start this and see like based on the projected monthly metrics, we can classify this as a large multi-provider practice. The current reporting period covers 7 working days, which is a partial month, compared to 8 working days in the previous month. Understanding that this is a large practice operating on a partial month's data is crucial. This allows us to set appropriate benchmarks and interpret projections accurately for your practice. To provide a full picture, we've projected the current month's net production. With an average. So basically, as you can see, like we have created two different agents. We have created an analyst, we've created an advisor. So for each of these podcasts, you are going to get their analysis on like different things. I'm actually, this kind of analysis, that something which even we are not able to see, or like maybe I'm not able to understand because I don't have like a full business context of like a dentistry business, but it's actually more intelligent than me in understanding like what kind of metrics that the practice need to be looking at, how to optimize those metrics, and what they need to be doing.